Or if he just says lump in the right iliac fontanelle to matlab raise ICP, and therefore in this patient lumbar puncture will be done. You will send the sample to the micro department and they'll be doing like Pelcam media isolation for this organism. Plus I told you the antibiotic that is used for Listeria monocytogenesis, ampicillin, and for the superior two it is ceftriaxone that would be used. Doctors are comfortable with the fact that single dose penicillin is used for syphilis, single dose ceftriaxone is used for management of gonorrhea in the patient also, and this would be presenting as a foul smelling periurethral discharge more in the morning. So you will take the discharge, you will make a slide of it. The slide would be having gram-negative diplodocus, that will be gram-negative would appear reddish in appearance, gram-positive will appear bluish to purplish in appearance, and this would be kidney-shaped organisms, and culture media is Thayer Martin and Chaconi. Now we comes to one of the most dangerous bacteria that is known to mankind, that is Pseudomonas aeruginosa, for which there are two MCQs to be remembered. One, he will say, what is the leading cause of ventilator-associated pneumonia? The answer is Pseudomonas, because the organism can survive in the tubings of the ventilator. The number one cause of VAP, ventilator-associated pneumonia, is Pseudomonas aeruginosa. Now, what would be my job? My job would be to use a selective media for isolating and diagnosing TB. So what we can do is sputum can be done. We can use the sputum of the patient for two things. One is we can stain with Zn stain, and second we will use a culture media that is called as Lowenstein Jensen media. So Lowenstein Jensen media is the main way of isolation of this.